Today, I'm delighted to interview Dr. Jaban Kuntia, Associate Professor and Director of the Health Administration Research Consortium at the University of Colorado Denver, on his recent publication with JMIR. Dr. Kuntia's piece is a cross-sectional study titled Digital Orientation of Health Systems in the Post-COVID-19 New Normal in the United States. Thank you for joining us, Dr. Kuntia.
Thank you, Dr. Joe. I'm very much delighted to be here.
Because of the unprecedented nature of the COVID-19 pandemic, the United States saw an unprecedented adoption of virtual care, most notably in telehealth. Your study takes a cross-sectional look at health information technologies across the US. Can you tell us why this is so important for us to understand?
We believe assessment of digital orientation is going to give us insights how the digital health transformation can help the healthcare. We know that there are disparities exist in health IT adoption in terms of tools and applications being adopted by different health systems and hospitals and clinics across the healthcare. Knowing where we stand is going to help the planning and preparation as we go ahead. And given that COVID-19 has disrupted several things in healthcare and thrown up newer challenges, at the same time, COVID-19 also showcased the acceleration of digital health tools and technologies, especially virtual care, remote care, telehealth kind of technologies. That has led us to think probably proactively we can do something to leapfrog our health IT adoption across the healthcare completely. That led us to assess and conduct this study.
And what are the big questions that you wanted answered by this study?
We wanted to showcase what or how are the four types of different digital orientations, such as analytics-oriented digital technologies, customer-oriented digital technologies, growth and innovation-oriented digital technologies, and futuristic or experimental digital technologies. These four differ in terms of their application, their use, their purpose, and so on and so forth. We know that some health systems have adopted data mining or analytics technologies. Some few have adopted customer-oriented technologies. Most of them may have some form of EHR, basic or comprehensive, depending on how they have adopted. However, when it comes to planning futuristic growth, innovation, experimental digital technology, such as one word that we have been hearing quite often is artificial intelligence or machine learning approaches, wearable and tracking devices. How exactly health systems are leveraging on this? That remains the big question that we want to ask.
By surveying CEOs, you obtained a data set of 124 health systems located across the United States with different characteristics, including size, region, ownership status, teaching status, revenue, number of physicians, number of hospitals, and other factors. Can you speak to the key findings in the paper?
I would not go completely in details of the key findings, but what I can say, some areas have been adopters of health IT compared to the other regions of United States. And that's concerning. That's concerning because when we talk about parity of or exchange of or coming at a level playing field, this may not sound good. For example, maybe Northeast region is better or worse than Midwest region, South region may be better or worse than West region. Whatever we have found is from the survey is a cross-sectional as it is right now. But what is concerning is why these disparities need to exist. Why medium-sized health systems need to do better or worse compared to large health systems. Similarly, compared to teaching and non-teaching, there is a disparity across that. And we have seen high burden health systems being better or worse in some aspects of these technologies. Which is doing better or worse, that's one part of the question. But the major question that we are asking after these findings and this disparity is why this disparity? Why can't the sector come across together and And with a policy intervention and help, why can't we see we are at stage 1 or stage 2 and we need to move to stage 5 or stage 7? And this is how the complete blueprint for the next 5 to 7 years looks. That's the biggest insight and finding and recommendation that we give out of this study.
It sounds like there are significant disparities across the United States around how digital technology are implemented. What do you think are the important next steps for the United States to ensure that the United States can be mindful of these disparities and potentially close the gap in them?
I would emphasize to have a solid blueprint at the national level to guide health systems to leverage the potential of digital transformation. Lack of consistency across these health systems would aggravate or accelerate these outcomes across different regions and health systems. And we saw that partially during the COVID pandemic, that different regions of health systems are responding in a much more disparate pace. That is not good. So utilization of digital technologies around this country has to be aligned, much more planned. This is where the policy, top level US policies need to play a role by giving we call in the paper as a clarion call from the top level of US health systems to shape a digital strategy and plan for the complete nation. Then health systems will follow that based on different mechanisms. Currently, we lack that plan. That's highly concerning, considering we are a developed, much more forward nation.
This is Dr. Jennifer Jo, JMIR Ambassador. I want to say a big thank you to Dr. Jaban Kuntia, Associate Professor of Information Systems and Director of the Health Administration Research Consortium at the University of Colorado, Denver, for letting me interview him on his recent Journal of Medical Internet Research publication titled Digital Orientation of Health Systems in the Post-COVID-19 New Normal in the United States, a cross-sectional survey. Big congratulations on creating this cross-sectional survey and highlighting the need for a cohesive national policy strategy and financial incentives in order to effectively create a well-visioned and articulated digital orientation for all health systems across the US. To read the full paper and other great research, be sure to go to jmirpublications.com. As a reminder, all articles are open access, meaning they are free and available to any user anywhere in the world.